Dental radiology is an important component to your overall dental service. We're going to talk about specific reasons why it's important, as well as some of the techniques for taking a good diagnostic image. And we're going to talk about some common pathologies that you'll see in your dental practice. Dental radiology is an important component only because it's probably your number one diagnostic tool for your dental patients. We need to change our thinking with our approach to dentistry. Years ago, it was a simple process. The philosophy was simple: clean them if they're dirty, pull them if they're loose. And we've evolved from that process, and our general practitioners are evolving as well by the use of dental radiology. And the thinking is we need to not only clean the teeth, but we need to assess properly and apply the appropriate treatment plan. Imagine, if you will, a Labrador Retriever walks into your practice, say 6 to 8 years old, and comes in with the clinical signs of vomiting, weight loss, PUPD, and lethargy. And so our rule-outs may be listed maybe as kidney disease or maybe diabetes. That would be, the first two things that we would most likely think of. And so how are we going to determine that? Well, probably the first thing that we would want to do would be to do some blood work. Maybe some x-rays, but most likely blood work is going to be number one on the list. Now imagine that you have no blood machines in your hospital. How are we going to make an appropriate diagnosis of this patient and therefore apply an appropriate treatment plan without knowing the definitive diagnosis? And this is what dental radiology does for your dental patients. We need to assess thoroughly and come up with a diagnosis for each tooth in the mouth so that we can treat properly. And we've gone beyond just cleaning teeth to just extract everything. We need to find those teeth that can be saved, or those teeth that are just too far gone for us to do anything, and we need to get them out of there and let that mouth heal and stop that periodontal process. So dental x-rays, absolutely, for making a diagnosis, are probably your number one diagnostic tool, along with your periodontal probe, as well as grossly assessing those teeth with the patient under anesthesia. One of the other reasons for dental radiology, we are finding that there's a lot of hidden pathology that just looking at a tooth, we're guessing. Most likely we are missing pathology that is present there, and that's bad for two reasons. Number one, it's poor patient care. If we send a patient out the door with bone loss and with changes in that tooth, around that tooth, and in the roots and the bone around that tooth, those are painful processes, and they're going to progress, and that's not good for the patient. That's just poor patient care. The other thing that's going to happen is if we don't find that pathology, we can't treat it. And whenever we do treatment, of course, we're going to charge for that. And if we're missing all of that, we're leaving money on the table. And in veterinary medicine, it's not only about good patient care, but it's about the bottom line as well. We want to all get raises. We want to have up-to-date equipment in our hospital, and the way that we do that is by becoming financially successful, and dentistry is absolutely one of those ways to do that. But unless we're finding that pathology, we can't treat it, and we can't charge for it. So we want to make sure that we're finding all of that hidden treasure and that hidden pathology beneath the gum line with dental x-ray.